My name is Jean, and I'm here to explain the benefit of a barcode medication system. This presentation is going to cover the need for a barcode system, medication errors, and the equipment that will be needed. I've been a nurse for 2 years. Using different medication carts, I've often thought there needs to be a better way to pass medications. The carts that we use are not ergonomic, nor do they aim at patient safety. My project is designed to put patient safety first. By implementing a barcode system, we would also decrease the time of the medication pass. Converting to the barcode system would be one way to decrease medication errors, increasing patient safety at Living Care Nursing Facility. This project includes updating our system to barcode-equipped medication carts. Converting to a barcode system would also increase nurse satisfaction at work. Computerized systems can eliminate illegible handwriting and confusing medical abbreviations. Physician orders input electronically decrease errors by half. The need. Decrease lengthy medication pass. The nurses at our facility spend much of their day passing medications. A barcode medication system would decrease the amount of time spent passing medications. Our current system and medication carts have ample opportunity for medication errors. This problem is not isolated to our nursing facility. It is nationwide. Medication errors are costly and can be devastating, leading to patient death. Medication errors cost the healthcare system billions of dollars each year. There is an estimated 45,000 adverse drug events, leading to patient harm and even severe patient death. According to one study, 25% of medication errors can be prevented. Implementation of a barcode system could reduce the medication rate by 56%. All over North America, tremendous pressure is being brought on all aspects of the healthcare system to improve patient safety and reduce medication error. Medication errors. The 5 rights of medication administration are the right route, right medication, right person, right time, and right dose. First, do no harm is a fundamental of all healthcare employees. Harm from errors, system flaws, and complication accidents, and known risks must be avoided at all cost. Medication errors lead to ethical issues, such as should a healthcare provider disclose errors or near misses to patients or their family. Medication errors happen for a variety of reasons: omission, unauthorized drugs, extra doses, wrong route, wrong form, wrong technique, and wrong time. There are laws for nurses to follow the 5 rights of medication administration. This is one aspect that all nurses should follow. If not, they could face being a defendant in a lawsuit. It would be wrong not to do whatever we can to eliminate medication errors. Medication errors in nursing homes account for 12.2%. The financial burden. Implementing a barcode system would be a system safeguard for our facility. Financial burden is multi-faced. Its legal ramifications toward the nurse or the facility. The facility would have increased cost of needing to order new medications. The facility could also be held accountable for hospital admissions for patients having adverse reactions. Nurses are accountable. Nurses are liable for 6 kinds of legal authority: federal law, state law, international codes, institutional rules and regulations, standing orders to the chief, and precedent of court decisions. My project description is simple: implement a barcode medication station. By updating our medication stations, we would be increasing the patient safety at our facility. This system would help in many ways: increasing patient safety, increasing efficacy of the nurses. The system would contain scheduled and unscheduled medications. It would be a central location for patient information. It would be a narcotic security system, no longer requiring 2 nurses to do a shift count of narcotic medications. The new system would communicate directly with our pharmacy, and they would deliver medications as they are needing the need for reordering. The solution would decrease the medication pass, increase nurse satisfaction, and decrease medication errors. This requires a collaborative team effort. A nurse using a touchscreen barcode system. All the patient information is available to this nurse with this system anywhere she is in the facility. The cassettes. The cassettes come preloaded from the pharmacy. The nurse scans and replaces the medications to the system. The nurse is then ready to pass the medications. Each cassette holds the same dose of medication, and the amount of tablets in each cassette depends on how big the cassette is. As the nurse scans the medication, the drawer opens, and the computer tells the nurse how many medications to pull. Here are some components of the system. The budget would be $93,000 for new carts, $15,000 for the new software, $25,000 for the project manager, $2,000 for a chart scan. Training time would be $5,000, and other unexpected costs would be $5,000, for a total of $135,000. Evaluation. These are the things we're looking for when we're with the evaluation phase. Is a decrease for potential medication errors, enhance in workplace satisfaction, and enhance patient safety. There would be less medication errors reported to the director of nurses. Within 1 month, we would see a reduction of errors. Nurses will report satisfaction with the system per survey, and also for a survey, patient satisfaction will increase. In conclusion, there are 4 things that we look for: patient safety, the decreased time for medication pass, reduced risk for medication errors, and increase in nurse satisfaction. The negative effects of medication errors is great. Implementation of a medication system is a safeguard, one way of lessening the effects and occurrence of medication errors. The system also has the ability to lessen the cost of the facility. By implementing a barcode system at our facility, we reduce the opportunity for medication errors, increase nurse satisfaction at work. This system would decrease the length of the medication pass, and of course, most important aspect, increase patient safety. This is the end of my presentation, and I'm now available for questions.